Welcome to the Ultimate Dental Podcast, the place where you can learn how to create a dental practice and a business life that you love. Listen in with Dr. David Moffet as he interviews successful entrepreneurs and successful business people and successful dentists as they share their business successes, their stories, and their breakthrough ideas, sharing pearls of wisdom that you can take back to your practice and implement immediately so that you can have that great practice with more patients, higher profits, and less stress. This is the podcast where great dental practices meet with successful business processes. Thanks for tuning in to the Ultimate Dental Podcast, the podcast where thought leaders, industry experts, and thriving practice owners reveal their very best tips, tools, and strategies that will help you grow your dental practice faster. Now, here's your host, Dr. David Moffet.
Hi, everybody, and welcome to today's episode of the Ultimate Dental Podcast. I'm your host, Dr. David Moffet. It is about 10:15 here on Monday morning in Burrowang, New South Wales, in Australia. And it gives me great pleasure to talk to two exciting guests that I've got in Fort Wayne, Indiana. And I'm talking with Jackie Hefty and Christa Nes-Iadicola from Dental Edit. So, ladies, welcome to the Ultimate Dental Podcast. Great to have you.
Thank you. It's so nice to be with you too.
Now, it's Sunday night, 8 o'clock over there in your time too, so I really appreciate you giving up your Sunday evening to talk to me and to share your story with my listeners and my viewers. It's great to have you. I was excited. I met Christa first on social media, and I was looking at the story. I thought this would be a great story to share. So tell me, how did you two, you've both got dental backgrounds, working in dental practices, and now you're dental coaches. Tell us about that story and how you decided to make the shift from being at the coalface and then helping dental practices get better.
Yeah. So my background is in clinical side. So I've been a dental hygienist for about 19 years and was really just feeling kind of burnout and wanting to seek a different direction. And in my experience as a clinician, many offices that I would go into, it seemed to have the same trend that there was a lot of chaos and just kind of going into survival mode, that they didn't have a lot of systems in place to implement. And Krista and I had talked several times. We had met through a mutual dental practice and started just bouncing ideas off of each other. And we're really excited to combine my clinical background, and then Krista has administrative background, to see how we could improve practices and really take it from a consulting angle.
And when we met, I was consulting in a practice. I was an office manager for 10 years. Before that, I did start in the dental field when I was in high school, sterilizing instruments, worked at the front desk for many years, graduated college, and then took the office management position. I did that for about 10 years. Once you get systems in a dental office, things run pretty smoothly. So I was kind of getting a little bored and needed another challenge. So I started consulting. From there, I met Jackie when I was consulting through my first business. And then we kind of decided to team up and join forces to offer a more clinical and admin view and put it all together to help office managers and dentists alike. So that's kind of how we started.
Excellent. So tell me, with your clients, who is it that reaches out to you? Is it the dentist? Is it the office manager? Who decides to find you to help them to improve what's not working properly in their office?
It's kind of a mix of both, honestly. We have newer office managers that are wanting to learn and excited to do that, and those office managers will reach out. It is sometimes the dentist. We find some dentists don't even have an office manager today, so if they have a smaller practice or maybe they have someone at the front desk, we see that the dentists sometimes reach out as well. So it's kind of a mix of both, but it's typically the newer office managers who feel like, hey, I know, we find too, a lot of office managers these days are like promoted from the clinicians. So maybe you've been a hygienist for 19 years, but you've never been an office manager. So you have the dental background, but we see those office managers when they first come into the role really struggle because they don't have office management training or sometimes just leadership training. So those office managers will reach out as well. So I would say it's kind of a mix, but typically it's a new office manager, a recently promoted office manager, or the dentist reaching out.
So do you find they're newer practices or they're practices that have been going for a while? Because sometimes, and you've already found this, I'm sure, that dentists get set in their ways and they're
Yes.
happy with just being average or good when
Mhm.
the difference between good and better and good and great isn't really that much different. It's just processes and making sure that things run smoothly and things have purpose, really, isn't it? So do
Yeah.
you find that it's new practices who are hot messes, or it's older practices stuck in their ways as well?
Again, I would say it's a mix of both. We do find both. So sometimes you can have an older practice that's had an office manager there for 15 years, and then that office manager retires and they're starting over. But typically it's always something that happens that sparks the dentist or the office manager to be like, hey, we need change here. We maybe don't know what we're doing, because we do see that all of us are set in certain ways. So that is a big obstacle that we overcome, as well as when we do get the call from a dentist to help out the office manager that they may have in place. That's always an obstacle to overcome as well, to kind of open their minds a bit to say, hey, you don't actually have to do it this way, that you've been doing it the whole time. Because a lot of us are used to the dental practice, very much used to living in that chaos. So it's always kind of like we start with like the mindset shift that it doesn't have to be this way. And not everyone always believes that.
I
So
think also too with like a satellite office when they're starting to it's growing that they're getting more dental practices within one provider. That is a challenge too. They're not sure exactly what this looks like to start another satellite office.
that and so with that is often a problem, isn't it? That you've got a
Mhm.
primary practice and a second practice, but the second
Mhm.
practice doesn't even run with the same processes that the primary practice.
Mhm.
So
Mhm.
it's an interesting conundrum. What's one thing that you know that you're going to find when you get invited into a practice? You know, there's always one or two things that they're doing wrong that you can just add water and it changes and it makes a
Yeah.
difference for them straight away. What are those secret things that you can get instant results for them?
I think probably consistency and accountability are two usual issues that we see and most common in a lot of practices.
Yeah, definitely. And I would say, to go into that a little bit further, it is always the consistency and accountability. It also is sometimes the dentist may think that the staff is doing something one way, but they're not necessarily doing it that way. So like you said, you can have one office, and here and your second satellite office is different. That's typically because the systems are not really dialed in or written down, and there's a lack of training and follow through on if those systems are being implemented the same way. But a lot of times it is just the consistency and accountability. So
Mhm.
it in any one task. So if your schedule is not full and you just started calling patients when your schedule just got empty, but you haven't had a real process in it or started being consistent over months, that's an area that we see a lot. And the staff are frustrated because maybe they haven't had phone training, they don't have the verbal skills really necessary to convert those patients. And then you're already in this sinking situation where your schedule is empty, which we know no one likes. That's stressful for everyone. So you're expecting immediate results, but you just started working on the issue. So that really is within any system, even if they do have a system in place. A lot of times we find there is no systems even happening and they're just kind of winging it every day. So that is the biggest thing. And then following up once those systems are dialed in and written down and understood, following up to make sure they're completed.
Mhm.
In the timeline stated.
Yeah, you reminded me there, Christa, of the practices where they have so many people calling that they don't care about cancellations because they will always fill with it either a new patient calling or somebody with a problem. Whereas
Yes.
the real problem is that that's very expensive because you're spending money to attract those new patients most of the time.
Yes.
That's expensive, and acquire them and then get to know
Yeah.
them. Whereas
Mhm.
when you allow people to cancel, where do
Mhm.
those people go? And then those people just drift away, and so
Mhm.
that's not a really good system at all. And that's probably one that most untrained, uncoached dental practices have is, I've always got plenty of new patients, or I've always got plenty of patients. I don't have
Yeah.
to worry about cancellations.
Yes.
Cancellations, you can be paying one or two people just to rearrange your schedule because you allow too many cancellations.
Yeah. Yes, that is something that we see often, and that is part of the, one of the first conversations if they are having that scheduling issue. And they say, okay, well, our new patients are high. They're more than they've ever been. Why is our schedule empty? And it is exactly what you just said there. They don't really have a system within it to retain their patients that they already have, which we all know is more cost effective than acquiring a new patient. And so they're just, that gets into a lot of other issues that we see. And Jackie can touch more on that from a clinical side, but these offices, there is common issue, but a lot of times then those offices are bringing those patients in. They need those patients. So they're not maybe establishing their protocols from the start. So those patients don't stay. And if those patients do come in, maybe they don't pay their bill, but then they always want to do treatment on those patients that same day. And that's where we see from the clinician side and even the admin team, that's where a lot of burnout comes in for these practices.
Are you finding that, Jackie, that you see a lot of practices, and this is something that I found with the people that I was talking to in the US, maybe 30+% of practices have a considerable amount of money in their book at the end of the day that wasn't in their book at the start of the day because they're doing a lot of same day dentistry. And
Hmm.
I guess that, if you've got a big office and you've got capacity to park people and keep them, that's fine. But it's also can create a lot of havoc if
Yeah.
you're jumping or roller skating from room to room to try and get things done as well. So
Sure. I think
reduce
it really is hard on the team. Yeah.
absolutely.
I think it's you're just operating in a it's still going back to the survival mode. If you have a system and hey, this is our protocol, this is how we're going to go through this, seeing this new patient, or maybe they came in for an emergency exam, how we go through the strategic plan of how we're going to see this patient rather than, okay, fine, let's do it today. And it's nice to do same day treatment, but at the same time, I think it also trains your patients how your office operates too. They quickly start to think that this is just the way that it's going to be, that they can always get treatment. And sometimes I think it kind of devalues what we do for them and appreciating our time and their time too, that we want to make sure that we do everything properly. And that's why we need to have them back on a different day.
Absolutely. I bought my neighbour's practice. He was retiring and his rooms were right next door to mine. So he came to work for me for a year and then retired. But as I took over his patients, the number that would come in and say, I'm here for a checkup, but I've got this broken tooth that broke 2 months ago. And I thought you
Hmm.
could do it today. And of course you can't because you haven't allowed the time. And so you've got to retrain all those people. When it breaks, call us because we've got time to do it. We schedule that
Yes.
emergency time so that you don't end up booking in with a disaster that could have been
Hmm.
broke. Re-educating those people was
Hmm.
quite the difficulty. I still meet dentists who say, I've got two clean. They're doing their own cleans, and they say, I've got two cleans, but if I can find a filling on one of those patients, I can fill the whole hour. And I'm going, that's not really good time management. It's not good for your team. It's not good for your patients. It's not really a good result at all. You're right. You've got to have those systems. And one of
Hmm.
the things that I've found, Jackie, that you probably teach is that the office really has to run. It has to revolve around the hygiene schedule. We
Hmm.
found this early that I couldn't be in three rooms at once doing two
Sure.
checkups and doing my own treatment
Hmm.
unless, I couldn't, the simple thing. If I've got rubber dam on a patient, I can't leave that patient to go and do an exam. What's the
Hmm.
patient? They can't talk to anybody.
Hmm.
I always had to All my rubber dam stuff had to be in the first half hour, and my hygiene checks are in the second half hour, and just simple processes like that.
Yeah.
And if a perio appointment cancels, don't put a new patient in there, because my book is based on the fact that I'm not going in for the perio.
Sure.
I'm in my own room, and these
Yes.
are the simple laws of the jungle that you have to have so that
Yeah.
everything runs smoothly. Because if it doesn't run smoothly, it's chaos.
Yes. And it just trickles down to every teammate, and no one likes to feel that way. And we still want to serve our patients to our best ability, the doctor and the clinical team. So, yes, I agree completely. It's really strategic planning and looking at that schedule and identifying those areas and really running the same way every day. That this is when we have time for this is when we have time allotted for this, and really sticking to that, I think, is respectful to your team and your patients, because your patients don't want to wait either. So there definitely is a system to stick by. And I think when everyone is trained accordingly and knows the way that we're going to execute and how we're going to address these situations, it just improves the workflow overall for everybody involved.
It does. Then I think there's two things that every dental practice really needs to make sure, and that is that their team get a full lunch hour and they get out on time. I think those should be the first two things that we have
Sure.
to operate, because that's what they'll complain about. I didn't get my lunch break.
Mhm.
Didn't get to go to my gym, my dance class, whatever.
Mhm.
I missed my bus, all that sort of stuff. And if you can get them out on time and you can give them a full lunch break, you've got a happy team. You've got a really
Yes.
happy team. And but what do most dentists do? They do their emergencies at lunchtime, and so
Yeah.
nobody gets a lunch break. That's
Yeah.
crazy, absolutely crazy.
Yeah, and it'll burn your team out pretty quickly. You'll start to notice those practice really have a high turnover rate, and you don't want that for your team, and it just doesn't run smoothly.
No, no. It's they say at golf clubs the number one complaint that members have is the quality of the sandwiches. It's not
Interesting.
about the golf. It's not about the golf course. It's just these sandwiches always. And so you've got to look past what you think your business is about and make
Yeah.
sure that your
Mhm.
business is really about looking after your people. And that's really the
Mhm.
first thing, is run to time. And so the other thing
Mhm.
that we found was that if we didn't have a hygienist who didn't run to time, you know, set structures in terms of their appointments, that just threw everything out. That was like throwing a stick into a bicycle wheel. The whole office just fell apart if they start running 10 minutes late. And
Mhm.
then you end up with patients being parked for an examination by the dentist, and the patient goes cold about
Mhm.
the restorative that's then all of a sudden thrust upon them. There
Sure.
is a real choreography to how a dental office runs smoothly and making sure
Mhm.
that it does.
Mhm.
And so the two of you obviously got a great combination, because one of you's got the clinical background, and then the other at the front desk knows what they expect to come out from the back and when they expect it,
Mhm.
what needs to be said. Because you can be the best receptionist in the world, but if the patient isn't prepared,
Mhm.
hasn't heard the information in the back, you can't sell it, and you then can't stop
Yeah.
them cancelling, because they have to have that in their minds all the time. What's my
Mhm.
next step? What am I getting this done for? What will happen if I don't? And
Mhm.
so it makes reception so much easier when that information is just part of the process.
Yes.
Definitely. And that's one of the biggest things that we touch on is, how to get your whole team on board and what each team member's role in the patient process is. Because
Mhm.
similar to, being concerned about the sandwiches at a golf club, patients aren't really concerned about the clinical care and how well or how fast you can do a crown. They're more concerned about their patient experience because they don't fully understand how we do a crown, right? So that's what we see, and the best way to really give them that level of experience is to make sure we are all on the same page, from the clinical staff to the
Mhm.
front team. So not giving them contradicting information when they're already trying to understand what's happening with their oral health when it's not necessarily something that is familiar to them,
Mhm.
and really walking them through that patient experience of, hey, we're going to take care of you. And Jackie's saying one thing, the front desk knows the next thing to say. So that's what we really work on, is really giving that seamless information. A big reason why patients cancel that we find or don't schedule treatment or even don't pay if you have insurance involved is just because they're confused. They don't understand, right? And that's always a communication error on the team's part. And even further, it could be they're just not trained on how to speak to the patient. But that is really one of the biggest things that we find. So when you have it working as a well-oiled machine, the clinical staff knows what the front desk is going to say, and vice versa. You can really serve those patients so much better. And we even go as far to really look at the situations where you do get in a bind, because it will happen even if your system is perfect. You're going to have your hygienist running 10 minutes late for at some point. And then we look at ways for then the admin team to come in and support clinical team and how that works. So we really like to have it all as seamless as possible to make the patient experience better and to really get that conversion that we're looking for at the end.
Yeah, I love that you're using my language, that patient experience, and that's what I built my practice on. I think it was 2010. I met a guy from Cleveland who did customer service for big business, and he had a process. And I remember ringing Jane from America and saying, "This guy's got the missing pieces missing in our practice. We're trying this, but we've just not got a system." So he allowed me to use his template to put dentistry into his template. And it's great because in our office, Christa, we worked out that there's three things that I had to tell the patient before they left the treatment room. And sometimes I'd be thinking 3 steps ahead and forget. And so my dental assistant would say, "Oh, Dr. Moffet, what will happen if this isn't done when you said?" Which is one of the things that I have to do. "Dr. Moffet, when do you want Mrs. Smith back to get this done?" And so just those prompts. And then the front office then also knew those three things that they needed to receive so that it secured the next appointment. When are we doing it? What are we doing? When are we doing it? And what will happen if we don't do it in that time frame? Patients seem to think that what's in here is like cleaning the garage. If we don't do it next month or the month after or the month after, it'll all be the same, but it's not. It just, everything gets worse in there. And so it's really drive that message home that now is now, and we need to do it as soon as possible. That's what the doctor said. So, you need that information at the front, and you need the hygienist to be acting with authority about the periodontal issues. You need the dentist to be acting with authority as well. What are we doing? We're doing, not we're giving them options.
Yeah.
Because they always think that all options are equal.
Yeah.
Yes.
And they're not.
The red blouse or the blue blouse or the white blouse, they're not. It's like a do you want a tiled roof or do you want a tarp on your roof? One's going to blow away.
Yeah.
It's crazy. But I
And I
love how
think
you
that
got these processes happening in your offices, and you can see this. How do your clients react when you give them these light bulb moments?
Yeah. First of all, I think it takes some time for some offices to get that light bulb moment, because there is they want to push back a little bit because they've always done it a certain way. But when you kind of move past that, they start to really understand. I can think of one example where we were working on verbal skills with the clinical team. And in this certain case, they were having patients say, like, you need a crown on tooth number 2. And the patient would just be like, okay, I don't, I'm going to wait. And the clinical team would say, okay. So then they would take the patient to the front desk and they would deliver that information in that way. And they would just kind of be like, okay, well, Jackie was in and she's going to wait on her crown, or they wouldn't say it at all. So they weren't setting up each other for success, because if I'm the one at the front desk, then I can't really even ask you to schedule that appointment. You've already shut it off. So with that, the most powerful thing was kind of role playing that situation, which no one obviously likes to do, but it's necessary, because when we're role playing as the patient and we're giving those objections, it's very eye opening for the doctors to see, okay, so they don't know how to overcome that objection of not letting, just not even giving any of those those reasons why the patient needs to schedule those appointments. So I think the biggest aha moment or light bulb moment is when they see that role play in action, because your team can tell you all day that they know how to do something. They know how to answer a new patient call. They know how to overcome treatment. But until you really can see that, those are the aha moments that a lot of times we'll go in and they'll say, well, we don't think this is our issue. Then we'll say, okay, well, then this role play should go quickly. Let's do it. And then it's okay, so maybe this could be contributing. So it's those things that, we don't learn that in we really don't touch on verbal skills in any kind of hygiene school, dental assisting school, even when you're getting your doctorate, they're not touching on those kind of things. So I think too, for a lot of staff, maybe that haven't been in the dental world as long, or maybe just, your underlying just personality goes into it as well on how comfortable you feel with answering those questions. But ultimately is what we think is if you're well trained for those and you practice them, um, it gets easier and it can be learned. So I would say those are the biggest aha moments when you're able to really diagnose an issue that you think is happening and then kind of catch it in the moment. Then they're sold from there.
Yeah, absolutely. I think that it's a sad thing when you see a practice that has survived on patches and patches and patches, and the patients are just used to things breaking all the time. Whereas when things are restored properly, sure, it costs a little bit more to get things restored with the best material, but it lasts a lot longer, and that's the
Yes.
important thing as well. And I was very fortunate. I was gifted a practice. There was a practice around the corner from me. The dentist was retiring. He wasn't able to sell. His real estate agent, who he paid the rent to, was my patient. And so my patient spoke to him and said, "You should come and see me." He just turned up at my door. He said, "I'm going to bring my filing cabinet over." Old school. This is 2002. Paper Kalamazoo files. And he said, "And I'll get my phone connected to yours." And he said, I said, "What do you want for this?" He said, "Just look after them." And so I don't think I ever saw that he ever did a crown on anybody's back teeth, um, or their front teeth for that matter. And so I just started restoring these heavily filled teeth with crowns. And the number one comment from the patients that took that treatment option was, "I've never been able to chew as well as I can chew now. I just feel my teeth are so much stronger." And so those patients really benefited from that transition into my practice, because it's the saddest thing when you see people, see, when I graduated, patients were, if they were lucky to get to 65, they had no teeth. They'd get a new denture and then they'd be dead before they'd needed their second denture. Now they're retiring at 60 and living till 80, and their teeth needed to last that long. So you had to catch them while they were working so that they could get their teeth restored properly, so they could enjoy the health benefits of having strong teeth. And so,
Yes.
it's often the case that, the what's best for the patient is also best for the dentist and the dental practice, but it's still best for the patient. And if you don't offer people that, you can do them a disservice.
Definitely. And that's one of the biggest things is we're telling patients what they need, maybe in a way that they don't understand. And then they're, not consenting. And then we're not giving them the full picture. We're not giving them the full information to even make an informed decision. So once you kind of lay it out that way too, because it is common that, a lot of assistants, hygienists, even dentists, they have this stigma that they feel like they are really selling dentistry. And it's like, well, you're actually, it's a disservice if you don't give them all the information. And once you kind of put it that way, and that is a big thing too, that they start to really fully understand, okay, yeah, that makes sense. We have to give the patient all the information to get an informed decision. And that is life changing for any practice when you can kind of overcome that mindset of going from the clinical staff, or even the front staff will have that same stigma sometimes that you're not selling dentistry. Your job is to tell the patients what they need, why they need it, and make sure that they fully understand that. And that's your role as the clinician. The front team, their job is to give that patient the information and help them work through how they can pay for that information and how they can schedule it. So once you really define those roles, that's when you see, as you were talking earlier, your assistant can step in and get you that missing piece of the puzzle, or your front can step in and give that information. And when each person knows their own what's expected of their job, then you can really work together seamlessly with your team without kind of throwing each other under the bus. And that we see often too, and saying, well, she didn't give me that information. One second, let me go ask your hygienist, or those kind of funny comments that tend to get made when you don't know each role. And when you don't have the team working together, it becomes more of a pointing finger. So that's really the best way that we find to really um, enhance the patient experience, is just to make sure your team knows their role, is answering questions within their role, referring to the person whose role it is when they don't have the answer. And that really helps with the team culture, which again enhances that patient experience.
You ever get called into an office where there's an obvious problem with one team member, maybe a queen bee type person, and then all of a sudden you've got to do a job that really the doctor should have done in terms of retraining that person or relocating that person to another practice?
Mhm.
How do you go
Yeah.
in those situations?
That can really, that is a major issue in a lot of offices, because it really only takes one of those toxic personalities or someone that's really bringing down the whole team. And I think that sometimes it's very difficult for the doctor to address those situations, or don't really want to address it head on. But it's so detrimental to the rest of the team to not handle it, and really just addressing it and making sure that it is taken care of is going to long outweigh that few moments of discomfort handling it. It's going to benefit your team, the patients, everything, that a lot of times it's went way too long and not been handled. But we really do make that a priority to make sure that we address those situations so that everybody can just move in a positive direction and recover and get on to the next step that they need to take.
We do see that quite often, more common recently. And it starts with a hard conversation, and the doctors they don't always want to hear it. 'Cause sometimes that person tends to usually be a longstanding staff member that is in place, but that starts with a hard conversation.
Yeah. So in those cases, sorry to dig on this, but in those cases, is the doctor aware? Sometimes it sounds like you're actually called in, we've got a problem, but we don't know what it is. And you find this toxic person and then you go to the doctor. Is the doctor kind of aware and wants to ignore it, or kind of totally unaware and wants to solve it? It can create a difficult dynamic for you, as
Mhm.
Mhm.
that's a roadblock to you achieving the success that the practice wants. They want the result, but they
Yeah,
hang on to old personalities and old habits.
absolutely. I would say it's a mix of both, but
Yeah. I would say it's a mix of both. A lot of times they are aware and don't want to address it
Mhm.
for the most part. There's sometimes that they do want to solve the issue, but I think it's kind of something that they try to push away, or, hey, this is all going to be fine, or don't want to address it. Or maybe the team is more aware than the doctor. There's just every case is a little bit different, but that's a really major issue that we always do try to address or identify within the practice right away.
Typically, they're really concerned of the fallout of dealing with that
Mhm.
issue. And then it's always a little awkward because they may have been dealing with that issue for years and they're just now starting to address it. So
Mhm.
it's a lot of that as well.
I think too, one of the issues is that it's often a front office person, and the doctor is fearful that if that person is moved on from the practice, that they will take patients with them, or
Mhm.
and that's never the case.
No.
Mm-mm. Right. They're also fearing, like, how are we going to replace them? Are we going to find someone? It takes a lot of time and they're already busy. They're worried about that. How am I going to train someone? Am I going to find someone that's in the dental field, or am I going to have to start training? How are we going to have time for this? It's kind of just a ripple effect of really fears that they have from dealing with the toxicity in the office.
And two, a lot of times those systems are not written down, and one person maybe has handled those systems forever. So that is a big concern. And that situation as well. They're willing to deal with like a toxic attitude or something like that, more so because they're afraid, okay, well, this person has all this information. So we can't really get rid of them. So that's another big one as well.
I've often found, and you've probably found this too, that when that toxic person has moved on, if it's somebody from within who then steps up, they actually get a really good result from that person.
Yeah.
Someone's been just hiding in the wings, but knows exactly what to do and does a better job more times than not. But it's all about that awareness of the employer, of the business owner, that the removal of the toxic person allows the business to, it's a bottleneck that they're hanging on to, and then all of a sudden the business really thrives once that person is gone. That person has probably been costing them lots of money and lots of anguish as well.
Yes, for sure.
Jackie, let's go back to hygiene. What are the good hygiene systems? You've obviously at its peak, my office had 3 hygienists on one day. Spread across. I was working 4 days, so there was seven hygiene days across 4. But you've obviously worked in offices a lot bigger than that.
hmm
Is it hard to get hygienists, like multiple hygienists, to all follow the one system?
Yes, I think so. It can be challenging. I think that's where it all tailors back to making sure that when you're onboarding a new hygienist, even if they're experienced, to really make sure that you establish some training with them. Like, this is how we're going to move through an appointment, and making sure that their communication and verbiage is right on with each other. I really think it's crucial to make sure that that is well implemented, because everything, just like you had touched on before, everything is reconfirmed from the hygienist to the doctor to the front staff. Everyone being on the same page is going to get that patient to that yes, whether it is for treatment, periodontal treatment, whatever the condition of that patient's teeth is. How can we serve them best? I do think there's a little bit of variation, how hygienists go about that. But really going back to the system of, this is what the hygiene appointment is going to look like from the new patient, from the time they come back to when we're handing them off, to when we're dismissing them, following up, really having all of that really dialed in. How do we handle each one of these situations? And the hygienist, as much as the rest of the clinical team, just plays a really crucial role, because the patient is really trusting them too, first, a lot of times before the doctor is coming in. And building that relationship with their patients is really important, and does have a big effect on their saying yes to treatment, or trusting the office. Can I trust the doctor? Sometimes they're asking the hygienist after the doctor leaves, like, hey, do you agree with that? They're kind of testing the waters a little bit across the board. And so really getting your hygiene team unified is just going to really thrive your practice in the right direction.
Absolutely, and it's one of those things that I was lucky to learn early, that my role as the dentist is not to be the almighty conductor, but to just play the rubber stamp and have the team build the relationship, and the hygienists build the relationship. And then most patients trust their hygienist more than they trust their dentist. And so that diagnosis, and I learned this by accident a long time ago, back in the 90s, when I went to have a consultation for laser eye surgery. And so I was in this ophthalmic surgeon's office for 2.5 hours before I met the surgeon. But by the time I'd met him and I'd been through all the drops and the orthoptis and the measuring, I knew that by the time I met him, this was the place that I was going to get my eye done. And I tell this story often, and I say, there's a movie like this. And people go, what sort of movie's like this? I say, it's a very famous movie. And it's The Wizard of Oz. Because by the time Dorothy gets to meet the wizard, she's already decided that he's the only person that can get her back to Kansas. She don't care that he's some little old man behind the curtain. He's the
Very
only
true.
one who's going to get there. So if the dentists can detach themselves and just get a hygienist who's on the same page, who does the pre-dentist diagnosis, and the dentist just comes agrees, then that practice is one that will really be in harmony right throughout, from hygiene to doctor to front office to clinical team. It's about that relationship with the diagnosis, and it's really, really important for the dentist to take 2 steps back, maybe more, and just be building up the hygienist all the time.
Yes.
But it's getting
Sure.
them to run on time. That's the issue of, you need to get me at this point. And if you can't get
Mhm.
me at this point, get them in for another appointment. Don't run late. Just,
Uh-huh.
get them back. Build the importance of perio all the time, because those
Mhm.
people appreciate that
Mhm.
you're saving the foundations before we're doing the restorative. I
Yes.
love how yeah, I love how you said that when you get on a new hygienist, they have to follow the systems of the practice. And that's, again, something that I find in a lot of dental practices. Everybody seems to be thinking that they are independent operators, dentists, associate dentists, hygienists. And so there's no system between one person and another in
Mhm.
giving clinical treatment. So you can't have that in a dental office. You can't say, "Oh, that's him," or "That's her. That's the way she does it."
Mhm.
Otherwise, you're running a mother's club sometimes.
Yes.
People just in there to swap photos and cakes, and doesn't
I
that
think
happen
it's
sometimes?
I think it's definitely, it's very important. We touch on that hugely, that what is the vision of the doctor that they want their practice to look like, and the culture of the office. And then what we are training and really setting each teammate up for success around that vision. And we want to provide comprehensive care for our patients. And what does that look like? How do we educate them or get them to yes? How does that look? And that's so important from the time that they walk in till the end. And really remembering and always going back to what is our vision for our practice? What do we want our patients to leave here knowing and feeling, experiencing? And also understanding the importance of the treatment that we are recommending for them, and not giving them a bunch of options, because they really are trusting you that you're the expert. And if we conduct ourselves in a confident way of that, the patients are going to feel that as well. When you start giving too many options, and, like you had touched on, I think it just confuses the patient. And they're like, well, they're always going to choose a lesser if they do not understand the importance of the best treatment for their, not only their oral health, but their systemic health too.
Yeah, it's you want somebody who's going to do uh, the best for you, and also to do it in especially in the mouth. If you ask any patient, do you want me to take an hour to do this, or um, would you rather me take 2 hours? They're always going to say, just do it as quick as possible, and they're never going to ask, is it cheaper if you do it quicker? They just say, oh, just in and out. So they
Yeah, they just
like
want
you
it
to be.
done.
They like you to be quick. They like you to be on time, and they like you to be as efficient as possible.
Mhm.
And then they don't mind spending that extra time in the office chatting with the staff as well. That's sometimes that leaving the office can take time, and the relationships
Mhm.
with the office team. Sometimes they come in early just to have a chat, and that's
Mhm.
really, really important as well.
Mhm.
It sounds like you are both really well connected with your vision, and I love that you talked about that, having a vision and a culture, because hiring staff based on that vision and culture is really the primary thing, rather than their ability to do a task. Because if they haven't got that vision, they won't fit into the team. It's they've got to they've got
Exactly.
they've got to all be working on the same page, and singing from the same
Mhm.
hymn book, drinking the same Kool-Aid.
Mhm.
It's really, really important that everybody is together. And I bring it back to football teams. Sometimes a football team can have two factions in the team where players don't like other players. And so the less factions you have, and it often comes down to culture of what they do away from training and away from games. And so it's just that, again, building that team culture is really, really important, and having that
Mhm.
goal is really, really important. Um,
Mhm.
Christa and Jackie, it's been great talking with you both. Thanks for being a guest on the Ultimate Dental Podcast. Anybody who's watching this podcast or listening to it, what's the best way for them to find you and get in touch with you if they want to find out more about what you can do for their practice?
Yeah, they can check out our website. It's thedentaledit.com, or give us an email, hello@thedentaledit.com.
That's the easiest way, and I've got that
Yes.
website up there, and it's a very interesting website to look at and very impressive as well.
Great.
Thanks very much. It's just gone 9 o'clock your time. I've been watching the
Yes.
sunset in the window behind there. Really
Yeah.
appreciate your time. Thanks again for being a
We
guest.
appreciate you.
Thank you.
Thank you so much for having us on.
Thank you for tuning in to another inspiring episode of the Ultimate Dental Podcast. We appreciate each and every one of you for being a part of our dental community and joining us each week on this incredible journey. If you found value in today's episode and you don't want to miss out on future episodes packed with expert insights and actionable strategies, here's how you can stay connected with us. Firstly, hit that subscribe button. Whether you're listening on your favorite podcast platform or watching on our website, subscribing ensures you'll never miss an episode. Secondly, share the love. If you know a fellow dentist or colleague who could benefit from the wisdom and knowledge that we share here, please share our podcast with them. Also, please share the podcast on your socials by simply clicking on the social icons wherever you view or listen to this podcast. Together, we can all do our bit to elevate the dental profession. And finally, stay engaged with us. We love hearing from you. Your questions, comments, and feedback fuel our mission to provide the best content for your professional growth, your personal growth, and for your practice growth. Remember, your journey to creating a dental practice and a business life that you love is our mission, and we're excited to be your trusted guide along the way. Thank you for being a part of the Ultimate Dental Podcast. Until next time, keep smiling, keep striving, and keep on tuning in to the Ultimate Dental Podcast.